10 years ago, a holistic solutions framework emerged that is transforming how humanity addresses its greatest challenges. Scientists, indigenous leaders, health professionals, and people worldwide united around one profound truth. We cannot secure the health of people on an ailing planet. A groundbreaking, cross-disciplinary commission was formed, and in July 2015, it issued a defining report.
We called it Planetary Health, the health of human civilization and the state of the natural systems on which it depends.
The evidence was overwhelming and continues to mount. Climate change, biodiversity loss, pollution, and other global-scale environmental change weren't distant nor distinct environmental problems. They were immediate and future threats to human well-being. Every breath we take connects us to forest ecosystems. Every drop of water we drink links us to watersheds. Every meal connects us to soil health and biodiversity.
Our home is awe-inspiring and fragile, and that just as it nurtures us and all living things, it also requires our care.
In December 2015, the Planetary Health Alliance emerged, not as another organization, but as a catalyst for transformation. What began with one meeting at Harvard University became a global gathering every 18 months. From Cambridge to Edinburgh to Sao Paulo, from virtual connections during the pandemic to breakthrough moments in Malaysia, each meeting expanded our understanding and our community. From 12 founding institutions to over 500 organizations across 80 countries, and now a new secretariat home for the Alliance at Johns Hopkins University, this decade has proven that planetary health approaches work. Cross-sector collaboration is generating breakthrough solutions. Indigenous and local knowledge systems offer essential wisdom that reshapes how we think about our health, environment, and justice.
Our ancestors have always knew what science is now proving, that healing the planet is healing ourselves. Planetary health gives voice to wisdom we have carried for millennia.
When we brought the annual meeting of the Planetary Health Alliance to Southeast Asia for the first time in 2024, we were trying to send a very strong message. The Global South is ready to lead. We aren't just talking about global challenges. We want to do things. We want to have a clear action plan and roadmap, and we want to take global ideas, but we need to embody them to context and take action where we are, in our own countries, in our own communities, in our own region.
My generation doesn't see environment and health as separate issues. To us, they have always been one fight for our future.
Our alliance created the building blocks to foster a thriving and active global community by developing foundational resources and tools, from education materials, pledges and declarations, and policy briefs to regional hubs and a rich and resourceful online presence. In Kuala Lumpur, in 2024, a new chapter began. Under the theme, From Evidence to Action, Confronting Reality, the global community created something unprecedented, the first ever Planetary Health Roadmap and Action Plan.
For the first time, we had a unified compass, clear actions for governance, education, business engagement, measurement, and communication that anyone, anywhere could follow.
The evidence of transformation is everywhere. Healthcare systems cutting emissions while improving patient outcomes. Cities designing for both human thriving and ecological resilience, as well as WHO's pandemic agreement and other global policy frameworks recognizing the interconnectedness of the Earth system and human health. The numbers tell a story of momentum, but the real story lives in communities where people are breathing cleaner air, eating healthier food, and driving the transformative systemic change needed to stabilize our natural systems and secure improved health for all. This October, as we gather in Rotterdam for our next annual meeting, we face a choice. We have the roadmap, we have the community, and we have the science. The question isn't whether transformation is possible, it's whether we'll act with the speed and scale this moment demands. This is everyone's moment. Health professionals, Earth system scientists, policymakers, communities, funders, governments, private sector representatives, and especially youth. 10 years ago, planetary health was an idea. Today, it's a movement. Tomorrow, it must be how we live. The health of all life on Earth depends on what we do next. Join us, and with hope for a better tomorrow, take action.